Hello, everyone. My name is Erin Laschnitz. I'm a small animal internist, and I teach some of the endocrine modules on Obi Vet. So I just wanted to make this short video going over some recent updates from the literature, just from the past couple of years on the diagnosis and treatment of Cushing's disease in dogs. I have another video that went over some of the recent literature on pathophysiology and clinical signs, so feel free to take a look at that as well. Going into some of the recent literature on diagnosing Cushing's disease in dogs, there is a paper from 2022 looking at the use of urine cortisol creatinine ratio for the diagnosis of Cushing's. This paper in particular was looking at the use of a particular analyzer to run the urine cortisol creatinine ratio. But this graph shows some of the results and just kind of points out how we would use urine cortisol creatinine ratio as a screening test. We know also that urine cortisol creatinine ratio is higher if you run the test on urine taken in the hospital compared with urine taken at home, even on that same day. So just a reminder that it is strongly recommended that if you're running urine cortisol creatinine ratio as a screening test for Cushing's, you do that test on urine that the owner drops off from an at-home free catch sample, and that can help prevent some of our false positives. There have been two papers that have come out over the past couple of years looking at ACTH stim and low-dose dex for the diagnosis of Cushing's. One is this paper from the Vet Journal from 2020, and this basically looked at the contribution of individual components of adrenal function tests and how useful they were in diagnosing Cushing's in dogs. And so this was looking at things like whether baseline cortisol or your post-ACTH stim cortisol were more useful, and the sensitivity and specificity of some of these tests. And then there was also this paper from 2020 in Vet ClinPath that looked at the different patterns that the low-dose dex suppression test formed in dogs with different types of hyperadrenocorticism, whether adrenal dependent, whether PDH, versus dogs with non-adrenal illness. And so I would encourage you to take a look at both of these papers just to remind yourself sort of what the sensitivity and specificity is of these tests for different types of Cushing's and what some of the benefits and drawbacks are of these tests. Now we know that the low-dose dex is a great test for an adrenal tumor, but it does suffer from sometimes having false positives in the context of non-adrenal illness. One of the things that sometimes we talk about and that I'm sure comes up a lot in general practice is whether recent dental causes your low-dose dex to become abnormal, causes it to be a false positive for Cushing's. So in fact, somebody looked at this and this paper from 2020 showed low-dose dex results from dogs after dental. These were healthy dogs, and it just shows you can see from these graphs that none of these dogs had a false positive low-dose dex. So you can feel free to go ahead and interpret your low-dose dex even after a dental. Another recent trend in the diagnosis of Cushing's, along with the diagnosis for lots of other diseases in veterinary medicine, is the use of machine learning or artificial intelligence to help sort of guide our diagnostics. So there was a paper in 2020 that looked at one machine learning model using a number of different clinical variables as well as some of your ClinPath variables. And they actually developed a clinical prediction tool that's publicly available. You can see the website here. If you Google Cushing's diagnostic prediction tool, you'll find it very easily. And this can just help you sort of understand the components that make it more likely a dog has Cushing's, what makes it less likely a dog has Cushing's. This can help guide your pre-test probability for dogs presenting for Cushing's testing. Then following this same group actually looked at different machine learning models using even more variables. And ultimately their best model, they showed a sensitivity of 70%, a specificity of about 80% at diagnosing Cushing's using just these models and none of our specific diagnostic tests. So as you can see, it's certainly not perfect, but it can definitely start to give you a sense before your ACTH stim or your low-dose dex of whether it's likely or not that a dog has Cushing's. Now, after diagnosing Cushing's, you might want to distinguish whether you have PDH or a functional adrenal tumor, and there are a number of different tests you can use to do this. But we know that often we will use ultrasound to help sort of guide our idea of whether it's an adrenal tumor or not. And so this paper from 2021 actually looked at dogs with hyperadrenocorticism that had ultrasounds. And so what they found was that about half of dogs with Cushing's had an ultrasound that was compatible with either PDH or an adrenal tumor, meaning it was easy to distinguish which of those it was based on the ultrasound. In contrast, about 40% of dogs, so a little bit less, but still a lot of dogs, they really couldn't tell based on the ultrasound whether it was an adrenal tumor or PDH. There was equivocal adrenal asymmetry, non-diagnostic for either one. So just to point out that you can't always entirely rely on ultrasound for distinguishing. Now, there was also a recent paper from 2022 that looked at a CRH stimulation test, CRH being the hormone that's released from the hypothalamus to stimulate ACTH production. And so this is sort of similar to the idea of an ACTH stim where you measure cortisol, but with the CRH stim, you measure ACTH. And as you can see from the graph, what you would expect is in PDH, you have uncontrolled secretion of ACTH, and so your ACTH is high at baseline, and then upon stimulation, rises even higher. In comparison to a normal dog or a dog with Cushing's due to an adrenal tumor, where it's not ACTH mediated, and so it starts lower at baseline and rises a little bit, but not as much as it would if it was a dog with PDH. So this group that published this paper in 2022 looked at the endogenous ACTH, or the sort of pre-stim ACTH, and the post-stim ACTH, and developed some sensitivities and specificity for using this as a diagnostic test. So then moving on to some of the recent work on how we treat Cushing's. Two recent papers have looked at Trilostane treatment in dogs with Cushing's and sort of how the results of our ACTH stim relate to owners' perception of disease control, of clinical signs, and owner satisfaction with how well disease is controlled. And as has been suggested previously, both of these papers really confirm that our stim is not really associated with owner reports of clinical signs or owner reports of how well their dog is doing. So I would encourage you to read both of these papers. They have sort of a lot to say about what does and doesn't correlate with owners' perception of clinical signs and clinical improvement, and what things you might consider monitoring if you decide to forego the ACTH stim for Trilostane monitoring. Then finally, when it comes to prognosis, there was a paper that came out in 2022 that looked at a handful of dogs that were treated with twice daily Trilostane. This was over a 5-year period from 2013 to 2018 in Spain. And they actually had a pretty decent survival. So the median survival time was about 2.7 years. They found some negative prognostic indicators, older dogs, dogs that were thin to start out. But I think this, reading into the details of this can help you guide your owners if you have dogs that you're starting on Trilostane. So that wraps up some of the recent literature on Cushing's in dogs. If you want to learn more, I encourage you to take a look at the endocrine modules in Obi Vet. Thanks very much.